It's that time. Lock and load. The Michael Berry Show is on the air.
All right, we were talking about Obamacare with Craig Gottwals. Les from Birmingham called in with a question for Craig, listening on WERC. Craig?
Hello?
Oh, I'm sorry. Hold on just a second. We were having a minor technical error. My fault, not Ramon's. Les, you're on the Michael Berry Show. Go ahead, sir.
Hey, Michael. How you doing?
Good.
I was just wondering what the thoughts were on the 30-hour work week, forcing full-time people out of full-time jobs and spreading it out to more people was just another way for the Obama administration to redistribute the wealth.
Well, it is, and you know, you raise an interesting point. I got an email from Stephen a few minutes ago. He says, Michael, your topic hasn't even yet touched on the pay scale changes. Now, listen to this, folks, because this is how people are living. He says, if you cut back to 30 hours a week from a 40-hour week, that's a 25% pay cut for an hourly employee. If you're a guy that used to get 10 hours of overtime, now you've got to find another job and work an extra 24 hours at the second job because now there's no time and a half. Let's say you're one of those guys who gets 20 hours of overtime a week, and there's a lot of guys out there working every hour of overtime they can for their family, make more money for their family. If you're one of those guys that was getting 20 hours of overtime a week, now you're working two 30-hour jobs and an extra 9 hours at a third job. That's 79 hours of work per week, or an extra 19 hours of work, just to make exactly what you were making before.
That's exactly right.
That's the one of many unintended consequences of a law that Barack Hussein Obama said was going to help people. And by the time it's implemented, it's going to do exactly the opposite. You're up, Craig.
Yeah, that's exactly right, Michael. I mean that, and to your I guess emailer's point was they're not typically, you know, when I've seen this, because I have hospitality clients as well, they're not cutting the hours to 30 because 30 triggers the mandate. And you know, if you're an employer, you know, if I cut him to 30 and he has to work overtime here and there and I can't avoid it, I'm going to have to buy him health care. So what you do is you cut him to 24, 26, something like that, because you have to leave a little buffer in there that when you look back and you calculate the average hours worked for this person over the course of the year, you got to make sure they didn't average 30 or they're going to trigger a health care purchase for you. So they're actually technically getting cut more than 30 in most cases, more than down to 30, you know, more sounds like 26.
So companies who, in many cases, are on the margin and simply trying to stay in business are now being forced, in order to comply with Obamacare, to harm the financial interests of their worker.
That's right.
And folks, this is how it happens.
Well, one more thing that I was thinking about as you were going through those two questions was, it's interesting because if you go look at the Hardee's Carl's Jr. CEO quote, it is kind of nefarious, because if you're in the administration where you used to have 3 full-time employees, now you got 5 half-time employees, part-time, and that helps unemployment numbers overall when you're just looking at the simplistic U3 unemployment rate, doesn't it?
I'm surprised that Hardee's even has employees, because I don't eat their burgers. I have no interest in.
Maybe when they're made by droids, they'll taste better, huh?
You need to find quotes from the Whataburger CEO. You need to find a quote from a CEO of a company whose food I actually like.
Yeah.
So, Craig Gottwals is our guest. At least Obamacare is affordable, right? It was the Affordable Care Act.
Right.
And Barack Obama said he was going to save $2,500 per family. Has that happened?
Yeah, no, that's not happened. It's gone up an average of 8 to 11% per year since he signed it, and that's per year. So you go back 4 years when he signed it, 5 years, we're up 50% almost in healthcare, just like we were beforehand, essentially. There's been a moderate slowdown, a mild slowdown in healthcare, but that has nothing to do with Obamacare. That has to do with the fact that people don't have money, they don't have good jobs, and so they're foregoing healthcare. As Obamacare puts in higher deductibles, people are starting to forego those elective surgeries they might get. That's why you're seeing a temporary slowdown in the growth of healthcare. And when I say a temporary slowdown in the growth of healthcare, I'm talking instead of growing at 15, it's growing at 10% per year, which only your utility bill and college education grows anywhere near that fast in our world.
Well, you've written that the Affordable Care Act makes health insurance so unaffordable that 87% need federal aid to buy their Obamacare. Yeah,
that was a wonderful statistic that we got out in the last few weeks. 87% of the purchasers on this year's Obamacare websites needed federal aid to buy their premium. Last year, it was 80%. This year, it's up to 87%. And if you look out all the way to the left coast in California, it's as high as 90%. And that's, I point to California because that's one of the states the administration points to as saying, look how great it's working out there, when 9 out of 10 people can't buy Obamacare without getting federal aid.
And Jonathan Gruber himself told the administration in a 2009 memo that this law does nothing to reduce costs.
That's absolutely right. He unabashedly in that memo wrote to the effect saying, look, that's fine. Let's just get the people covered. We'll worry about costs later. Costs really come down to one thing, and that's rationing. We're going to have to start turning the messaging into, hey, that surgery that you want, it doesn't really work. So we're not going to pay for that particular surgery that you might want or that particular drug. He wrote that in a memo.
Well, and that moving or redistributing the wealth did nothing to reduce cost. We knew that. Anyone who'd studied basic economics understood. It also provided no incentive to keep costs down on the consumer's end if someone else was paying the bill. I mean, look at a public housing project. They don't take care of it. And the only way you could keep costs down was to refuse to do medical treatments for people who needed them. And therein lies the irony of Sarah Palin being called crazy for the death panel comments. But the fact is, Rahm Emanuel's brother has repeatedly said, you don't need to live past 70. He wouldn't want to live past 70. Why are we wasting money on health care for these people?
Yeah. Rahm Emanuel and Zeke Manuel are two really effective spokespersons for this program, aren't they?
They're something special, that is for sure. Craig Gottwals, it is always a pleasure to have you on. Thank you for the good work you do researching the minutia of this and helping people understand how it's going to affect them at their level.
Thank you, sir, and I promise I'm going to make it to the Redneck Country Club in 2015. That's on the bucket list this year.
I look forward to it, my man. I look forward.